name is Robert Wolf. I'm a board-certified orthopedic surgeon, fellowship trained in sports medicine, and I'm going to be talking about common shoulder injuries. Your shoulder, this is the anatomy of your shoulder. Your shoulder is like a ball in a socket. The ball is the top of your humerus, your arm bone. The socket is part of your shoulder blade, and they are held together by ligaments and muscles. In adults, one of the most common injuries that we'll hear about are rotator cuff injuries. The rotator cuff are these group of muscles that run from your shoulder blade and they cover the top of your humerus, your arm bone, and they give it strength at your side and help you lift your arm up over your head. In people who are 30 and older, this is probably the most common injury would be a rotator cuff tear, and that's when this attachment of the muscle actually pulls off of the bone, and it can be from trauma or just from wear and tear from age-related processes. Those injuries cause weakness on external rotation of the arm and lifting the arm up, and they cause pain in the lateral aspect of the shoulder. And that's one of the most common things that we operate on. Surgery to repair this is highly successful. What I do is an arthroscopic shoulder surgery, which is a surgery where you take an arthroscope, which is like a microscope, and look into the shoulder through some small incisions, and through a minimally invasive technique, we take the tendon and repair it back to the bone. Over a period of about 3 months, that tendon heals back to the bone, and we progress you through a rehab program where you progressively increase your flexibility and strength. The overall success rate of the surgery is about 90% in terms of restoring strength and function in the shoulder. And it's very beneficial if you have a rotator cuff tear and you have weakness associated with that, and we treat that non-surgically, that can lead to progressive weakness, pain, and arthritis in the shoulder that can sometimes necessitate a shoulder replacement, which is a much bigger surgery. So if you have an injury like this, it's a really good idea to get in and see somebody like myself who is trained in treatment of these injuries so that we can help you get better. In younger people, the more common injury that we see that requires surgery is a tear in the labrum. The labrum, once again, shoulder's like a ball and socket. That socket has a band of tissue that runs around it called the labrum, which is where the ligaments that hold these two bones together are connected. And there's a picture of that right here. And the labrum is this band of tissue. When people play sports, when they play football, other types of contact sports, and basketball or soccer and things of that nature, and they fall down and they injure their shoulder, they can dislocate the shoulder where the ball actually comes out of the socket. When they do that, they tear the labrum and the ligaments that hold the shoulder together. Now, sometimes that can heal well with non-surgical treatment and an appropriate rehab program, so we always try those things if it's appropriate, but oftentimes people will have repetitive injuries where they'll start dislocating their shoulder over and over again, or they'll have pain and dysfunction just from the tear in the labrum. And in those situations, we can do a labral repair, which is a arthroscopic shoulder surgery where we insert the arthroscope into the shoulder, take the labral tissue and sew it back to the bone, the glenoid, which is part of your shoulder blade, where it avulsed from, where it tore. And once again, that's a highly successful surgery in terms of recurrent instability, in terms of preventing dislocation. It's about 90 to 95% successful. The recovery time is about 3 to 4 months, which is some time, but it's a highly effective surgery and can allow athletes to return back to contact sports and various other levels of sport with excellent function in most cases. If you have a shoulder injury and you want to come in and get seen for that, I'm happy to see you. You can call my office, Summit Orthopedics at Grandview Medical Center at 205-971-1750, and we're happy to see you anytime.